19th of October in this year 2021. Now remember, COVID is still with us, and we are battling with COVID even when the threats of infection keep going lower. We've not officially heard from the Ministry of Health, we've not officially heard from WHO, we've not officially heard from the scientific advisory team that there is no more COVID in Uganda. So because we have not had that announcement, we still consider COVID to be with us, and the only thing that we can do to fight COVID-19 is to continue as much as we can to adhere to all the SOPs of sanitizing, washing our hands with clean water and soap, to keep a social distance, wear masks in public as much as we can, and lately we are now also talking about vaccination. Do as much as possible, do as much as you can to ensure that you get to all the vaccination centers available across the country. It's not just a Kampala affair, it's across the country. Go other different health facilities in different places, vaccination taking place. Go receive your first jab or second jab or whatever that is, to ensure that we hit the target and open up for the economy to fully blossom like we used to be before COVID-19. Away from the discussion over COVID-19 and the reminders, we're now back to a conversation of this morning on GMU Extra, and with me in studios are two very important persons here to talk about post-abortion care or post-abortion contraceptives, and to see how to enhance awareness about this. In studios with me this morning is Madam Nakalembe Fatuma, the Community Engagement and Outreach Manager for Coherinet. Welcome, Nakalembe.
Thank you very much. Once again, I'm Nakalembe Fatuma. I work with the Community Health Rights Network as the Community Engagement and Outreach Officer. Community
Health Rights Network.
Yes.
That's what you call Coherinet.
Coherinet in short.
Where are you based?
We are based in Kawempe.
Okay, yes. Welcome, and thank you so much for joining me this morning. Together with Nakalembe Fatuma is Mariam Mirembe, and she is a Human Resource Manager and also Assistant Director for Coherinet. Welcome.
Thank you so much. Good morning, our dear viewers. I'm Mirembe Mariam, and I work with the Community Health Rights Network.
Very important. Let us talk about post-abortion, but before post-abortion, there's abortion itself. What is it? And why would we even talk about abortion on national television? Mirembe, Mariam.
Abortion is a very important matter that we all have to know about. We have to be aware that abortions are taking place in the community, and in Uganda you find that 8% of maternal deaths are due to unsafe abortion. So it is really an important issue that we really need to discuss.
It's an important issue?
Yes.
To all of us?
Yes.
Nakalembe?
Yes.
We would even talk about abortions because abortions are induced. Abortions, she's giving statistics of maternal deaths emanating or coming from abortions, unsafe abortions. Would we even advocate for safe abortion? Because abortion is abortion. Are we trying to paint a good picture of abortion?
It's not that we are sugarcoating abortion, but we want to address the challenges or the causes of unsafe abortion. Remember, if a woman is empowered about safe abortion, that woman cannot make a mistake to carry out an unsafe abortion unless she's not knowledgeable. So we would like to tell people, despite the challenges people go through with unwanted pregnancies or unplanned pregnancies, they need to know they have the right to information to abortion. Yes, despite you're not going to carry out an abortion, but you have the right to decide to know what an abortion is or what safe abortion is.
Well, on the other, human rights activists also wage war against you because it's constitutional for right to live. It's my right to live. And why would you abort me? Why would you terminate me? Because an abortion is a termination of life. Won't you find problems? Just discussing this and possibly getting it anywhere?
I wouldn't say that we'll get problems or challenges, but it's one's right to get information. And at the end of the day, it comes back to someone's decision. Because it's my body, it's my right, and it's my choice.
Is that legal in this country? Is it legal in this country to abort?
It's not legal.
It's not legal?
Yes.
Okay, how would you even talk about an illegality?
It's not legal, but it has provisions where a woman can terminate a pregnancy in case she doesn't want to have a pregnancy. In case a woman has a mental disorder, she can. In case a woman has those terminal illnesses, let me say cancers, the CD4 counts are low, a woman can have a termination. So there are provisions where a woman can have these terminations in Uganda.
Do you have experts to do that in this country? Are there different health facilities, or somebody can just decide to do it because they feel they have a problem?
Okay, in most cases we do partner with like-minded partners, but when they are providing the abortion services, they provide abortion services in regards to what the law accepts.
What does the law accept? Mariam?
The law in Uganda is illegal when you're saving a woman's life, but it only permits a licensed, trained service provider to carry out the abortion. But according to the 2012 National Guidelines for Sexual Reproductive Health and Rights, they go on and permit abortion in cases of rape, incest, and fetal anomaly, as well as if a woman is HIV positive. They allow that woman to have an abortion.
Won't we promote promiscuity in society if we allowed Mariam and Fatuma to officially abort? Go have sex, unprotected sex, you are pregnant, and on the way you discover you have a problem with this man who made you pregnant. 2-3 months later, you say, "Sijana kumuzalira mwana ono." Then you go, because the law allows you to do that. Won't we just promote promiscuity if we allowed for abortions? I'm only thinking.
No, I believe it is a matter of someone's decision to terminate a pregnancy, and we all have to understand that women have different issues or have different reasons as to why they may need an abortion. But we have seen in countries where abortion is legalized, you find that the number of women that are going to facilities to actually access the abortions is actually low. Meaning that legalizing abortion will not only save women's lives, but it will also help reduce the cost that we put in post-abortion care. So we really need to talk about abortion and give out the right information. Let women have the right information. Let women know what they want to do with their bodies. Let us give the power back to women so that they decide what they want to do with their bodies. And in this, we shall be able to see more development, and we shall actually reduce the number of people that are dying due to unsafe abortion.
Okay, we'll get to post-abortion care, but just before you get to post-abortion care, do you think you'll have the support of culture and religion in this country?
It is going to be really a journey for us to walk, but we really advocate that religious leaders or culture leaders, they have to understand that abortion is a matter of health. It is not about religion, it's not about culture. We all have cultures, we all have religions, but we really need to look at abortion in a health perspective.
Well, I am looking at you first in the Inter-Religious Council of Uganda to see whether Muslims will say yes to that, or the Christians will say yes to that, or whatever that may be. But of course, we know that abortions are not legal in this country, but they're actually happening. Now let's talk about post-abortion. What is post-abortion care? And who teaches it even? Fatuma?
Okay. Post-abortion care is an act of treating complications due to either spontaneous abortion or induced abortion.
What are spontaneous abortions?
Spontaneous abortion, this is an abortion that occurs by itself.
Isn't that a miscarriage?
Yes, it's a miscarriage.
How do we call a miscarriage an abortion?
It's a type of an abortion, according to the World Health Organization.
According to?
The World Health Organization. It's also a type of an abortion.
A miscarriage?
A miscarriage.
Well, I'm yet to learn so many things.
Yes.
I think a miscarriage is a miscarriage because nobody wants to have a miscarriage, I'm sure.
Yes.
But somebody can choose to have an abortion.
Yes.
Yes.
Yes, a miscarriage, it's not one's will, but it's again a type of an abortion.
Yet abortion,
because you have not taken
induced.
the pregnancy to term, so that means the pregnancy has come out. So that means you have not produced a baby. So it's also an abortion.
So post-abortion care or contraceptive. Now, what is post-abortion contraceptive?
Okay, post-abortion contraceptive, in case a woman has gotten post-abortion care services, the woman is taken through a process of being counseled about contraceptive options after the post-abortion procedure. Then the woman is given the contraceptives.
What are contraceptives in this case, Mariam?
Contraceptives, let's take them as family planning methods. So we look at family planning counseling. A woman is counseled after the abortion, all the post-abortion care has been done. Like that is a treatment, when she has gotten treatment of an incomplete abortion, then they are counseled, then they go into that process of being taken through the family planning methods.
And how does somebody get that?
Pardon?
How does somebody get that? For the women who have gone through abortions, or I don't want to talk about miscarriages because to me a miscarriage is spontaneous.
Okay, in case a woman walks in a facility, because post-abortion care is in government facilities. So in case a woman walks in a facility, the woman is given the post-abortion treatment. Then after the process, the woman has to be taken through what contraceptives can a woman use after the procedure.
Would it be prudent now to emphasize, to teach and to advocate for unwanted pregnancies, to avoid unwanted pregnancies, to preach against unwanted pregnancies? Would that be your advocacy at its peak?
Yes. That's why we are advocating for post-abortion contraceptives, because we don't want this woman to go back and engage into sexual intercourse and get unwanted pregnancy again.
So does a post-abortion avoid somebody from getting
post-abortion contraceptive? It can prevent a woman from getting unwanted pregnancy again.
Teach me about that, Mariam.
I beg to understand the question.
She just said something. Post-abortion
contraceptives
fail somebody, or they hinder somebody. They curtail, they curb unwanted pregnancies. And I just want to know that because you've conceived, you've gotten pregnant, you've aborted. How does that stop you again from getting pregnant?
Okay.
It's what I want to understand.
Okay. So in Uganda, maybe just to go back on the statistics, you find that 4 out of 10 women in Uganda have an unmet need for contraceptives. That is, like, you find that there are women who don't want to get pregnant, but they don't have a contraceptive that they're using at the moment, but then they don't want to get pregnant. So if we integrate...
When both are choices, not getting pregnant is a choice, and not choosing a contraceptive is also a choice.
Yes.
Okay.
Yeah, and
you talk about the integration now.
Okay. So I don't want to get pregnant, but I don't have a contraceptive that I'm using. Either I'm not aware, or I'm aware but I'm afraid of the myth that are surrounding contraceptives. So I may be afraid to go and get a contraceptive myself. So that's why we advocate that women should be counseled, because when you find the workload that our health facilities have in government facilities, especially where PAC is offered free of charge, you find that there is a lot of workload, and you find that the maternity ward is also the ward where PAC is done. So women don't get a lot of, like the midwives, all the doctors don't get enough time to actually counsel or take these women step by step on actually telling them what kind of contraceptive they should use, or if I use this particular contraceptive, this will be the result, or these will be the likely side effects. So since women don't get, since midwives don't get that much time to be taken through, to be counseled on how they can make the right choice for their bodies, you find that many of them end up leaving the facilities without a contraceptive. Meaning, if I go without a contraceptive, I'm actually sexually active. So there is a possibility that I'll get an unintended pregnancy again. So if I'm not ready for the unintended pregnancy, that means I'll have an abortion. And if I have an abortion, still, if I have it unsafely, I'll come back to the same facility. So that's why we advocate that there should be more time allocated into the counseling bit. If women are counseled about the contraceptives, then they will be able to access more, and we shall reduce on the number of unintended pregnancies that are on the rise at the moment.
How do the advantages of abortion weigh against the disadvantages? Because we're looking at that, and lately we've been talking about the rising numbers of school-going children now getting pregnant, of course unwanted pregnancies, because of quite a number of things. People attribute that to the closure of schools. I don't want to think like that, because this girl who's possibly still get pregnant, we've seen them get pregnant in schools, or even when the schools are open. But how the advantages weigh against the disadvantages? And do you also, if somebody just walked in and she says, I am 5-6 months pregnant, but I do not want this pregnancy because, one, I'm even doubtful of who the father of this baby is. So because of that, I do not want to give a birth to a bastard or somebody whose paternity I am not sure about. You just advise them and tell them, let's terminate it from here. Or what? I am only trying to fit in your shoes, and this is the tall order I'm qualifying.
Okay, in case someone comes to us and they're in need of an abortion service, they're 5 months pregnant, they don't have any challenge. The biggest thing we first do is counseling.
Against abortion?
We give the woman options. We give the woman options, and we leave the ball in the woman's hand. Because sometimes a woman can come to you and they're like, okay, I want to have a termination because maybe I had a challenge with my husband and all that. So we do counsel these women and we leave the balls in their hands. As Coherent Unit, we believe it's always a woman's right and choice to decide on whatever they want for their bodies. Yes.
I asked about the advantages and disadvantages. What outweighs the other? Because you're making it look like it's some easy thing to have to abort, or it's even the best thing to do for somebody who doesn't want their pregnancy.
Okay, we are not saying that it's the best thing for someone to do an abortion, but what we are saying is, in case a woman is caught in a fixed corner, let me say I have a big challenge and I don't feel like I can have this baby. Let me say I was raped. For sure I can't give birth to this baby. We say, okay, you have this and these options. So it comes back to you to decide which option do you prefer. Yes.
Mariam, in all honesty, the people who come and the people who seek or the people who keep doing abortions, do they give those very health reasons of, you talked about mental illness, you talked about low CD4 counts, you talked about terminal illnesses, you're now citing issues of rape. Do all of them have these justifications, or they come for different reasons, but because they think it should be done, then it should be done?
Women give different reasons as to why they need the abortion, and to us it's a no judgment zone on our side. So whether a woman has a terminal illness and they want to abort, or they want to abort because they feel they are not ready for the pregnancy, our role is giving them the right information, not to do it unsafely. Because at the end of it all, if this person doesn't have the right information all on how to go about a safe abortion, then these are the women that we are seeing that are doing unsafe abortions. So these are the women that are actually contributing to the 8%. And these are the same women that go on to the health facilities to actually get post-abortion care. Why? Because first of all, you find that they don't have the right information. Secondly, others, our law itself, it is restrictive in corners of health. Okay, but they don't look at, it doesn't look at these other reasons that a woman may have, maybe the financial status of this particular person. She may not be able to take care of this particular child or this baby if given birth to. So you find that it is really challenging, and our law really limits women to actually have a choice or to decide what they want to do with their bodies. So it would be very important if there is a revision in this law let it permit a woman to actually have abortion when they really need one. It is not like the number of women having abortions will rise, but we shall actually reduce the number that is dying due to unsafe abortion. So you understand, we really want to have case scenarios. I don't know, at least one time we shall be able to bring these women that have lost their uteruses. This person has become infertile. They can never give birth again. Why? Because they had this unsafe abortion. They used the hanger, they perforated their uterus. And you find that our government is actually putting in a lot of money for post-abortion care. So if we have at least abortion, if a revision in the law regarding abortion, we believe more lives will be saved.
So what are some of these risks of abortion, or the bad side of abortion? And how many times would somebody abort to still be safe, to still be secure, even through safe abortions? Because people would have reasons for aborting any other time. How many times would somebody abort? Just like somebody would choose to say, for as long as I can, I'll give birth to 8 children, 9 children, or 10 children for as long as I still can handle. Somebody can say, one baby is good enough for me, and they stop at that. How many times would one abort safely?
A woman can abort as many times as she can. As many times as she can.
Provided it's safe.
So somebody can choose to say, well, I do not care.
Yes.
For as long as I can do it the right way.
Yeah. However, there are complications related to unsafe abortion. We are actually talking about the unsafe. Why? Because it is the major contributor to unsafe abortion. And some of the complications that cost a lot, we have the incomplete abortions, the women that come to the facilities with incomplete abortions. And there are the most severe complications are sepsis. There is perforation of the uterus. That is where you find that a woman will lose their uterus due to maybe their uterus is in really a bad state. And the least they can do is actually remove it to save this person's life. There are lacerations. So there are so many complications related to unsafe abortion, and that's why we really need to do a lot.
Apart from counseling, what other things you do? Because you only talk about counseling, but safe abortions, what else do you do with these people? Are there experts in hospitals that are actually doing and carrying out abortions, that somebody can actually walk into this facility and say, and at what stage of the pregnancy is it even safe to actually abort?
Okay. When a woman comes to us, or when a woman calls our toll-free helpline number, Anti-Kaki, and they are in need of post-abortion care, we always do referrals. We do referrals to our friendly, mapped trained facilities, so as they can get the services from the facilities. And you talked about how many months is it safe. According to the World Health Organization, it says abortion is more safer in the first trimester. These are 12 weeks and below. So 12 weeks and below, it's easier.
12 weeks is about 3 months?
Yes.
3 months?
Yes.
You want to say something on that?
Okay. So, and the people that are qualified to carry on the abortions, we have midwives, nurses, gynecologists. Those are the people that have this particular training to carry on the abortion procedures.
Okay. And I'm still failing to understand the advantages outweighing the disadvantages.
The advantages of abortion?
Oh, yes.
Oh, one, the advantages of abortion, one, it saves life.
That's safe.
That's safe. How? Nakalembe, I can decide to have an abortion and decide to do unsafe. I can lose a life in the process. Two, an abortion can help a woman. Let me give a scenario. I'm a married woman and I had sex with another person. So it can save a marriage. Yeah, and some other people choose abortion as their contraceptive. It's better. It's better to use it than undergoing all the side effects of contraception.
Some use abortions as contraceptives.
Some. I said some.
Some, yes. And yes. I'm also emphasizing some.
Yes.
Some use it for that particular reason.
Yes.
Oh. Mariam is laughing. Mariam, I am looking at this as well. I don't know. We will cut this in the next maybe 5 minutes. But by and large now, talking about unwanted pregnancies, and of course, what is the prevalence of abortions in this country? What is the prevalence? Where do we have the most at risk? And who are the most at risk in this particular? Is it spread across all women of birth-giving age? I don't know. You are the experts, please.
Abortions, according to a report, Ministry of Health 2021, abortions were carried on, unsafe abortions were carried in the ages of 10 to 24.
10.
But yes, but when you look at the 2013 report on post-abortion care, you find that 93,300 women were treated due to complications of unsafe abortion.
93,000?
93,300 women were treated due to complications of unsafe abortion. So, and this was in ages of 15 to 49. And these are the reproductive ages. Yeah. So you find that the problem is really escalating.
What needs to be done, finally?
What should be done? More community awareness is needed. We should create more community awareness in regards to availability of post-abortion care in government facilities, as well as more emphasizing of uptaking post-abortion contraceptives. Yes, for women and girls.
So what do you do when you go to the communities out there and you talk about these things? I'm seeing myself as a parent, and I'm seeing other parents, of course, looking at you, preaching to them how to abort, preaching to their daughters how to abort, and maybe when to abort, and why they should abort. How do you package your information when you get to the public?
Okay.
To be appreciated, and of course 2 years.
When we go down to the communities, as Coherinet, we work with the grassroots community people. So when we go to these communities, we don't talk about abortion directly, but we package our messaging depending on the target group. Let me say you're talking to young people. Obvious case, you have to start with what happens when you engage into sexual intercourse. So after that, then you take them through, okay, in case you engage into sexual intercourse, what happens? Sometimes people conceive. Sometimes when people conceive, they decide to take their pregnancy to term. Others decide to carry out abortions. But in case you're to do an abortion, or in case people are doing abortions, what do they do? According to the statistics, we are seeing so many girls are dying due to unsafe abortion. So you take them through the challenges and the dangers of unsafe abortion.
Okay.
Yes. So we also give them our toll-free helpline number. In case anyone wants to talk to someone, you can talk to us. So we package according to the target groups we are to meet. Thank you very much.
Fatuma Nakalembe, final from you in just 1 minute. Mariam?
Yeah, for me, I would call upon the government, all the members of parliament, to do a revision in the law regarding abortion, to allow women choose what they want to do with their bodies.
Okay. Well, I thank you so much, Mariam Mirembe and Nakalembe Fatuma from Coherinet, community for, what is it called?
The Community Health Rights
Community Health Rights Network, Coherinet. Thank you so much for having allowed to join us this morning on Good Morning Uganda. And of course, my message to that is I can only talk to the ladies and the women out there to avoid unwanted pregnancies as much as they can, and especially the school-going girls. Do as much as possible to avoid the things. I wouldn't actually tell you to wait for abortions or even think about abortions, but I'll just emphasize that don't get into the things when you're not ready. Go to school, study, qualify, get a job, or do not even get a job, but know that you're actually of age. You've clocked the age, the consenting age, 18, 19, 21, adult consent, and then get married to that man or that woman and start that marriage at the right times. But of course, like I said, these are the issues that keep coming along the way, and I can only advise that let's do the best to ensure that we actually avoid unwanted pregnancies as much as we can. We'll take a break here and return shortly with another conversation again. Good morning.